Police departments and policymakers grappling with how to deal with mental health issues.
We do not have a mental health officer, and that is one of the problems we have throughout the state and this nation is the access to mental health.
This is just one example of the mental health crisis facing local law enforcement. A Lawrence County deputy remains in the hospital after he was attacked in a standoff on Sunday. 2 other Moulton police officers were also injured in that incident. They have been released from the hospital. Good evening and thanks for joining us. I'm Demetria McClinton. Bill Young has the night off. We found out firsthand in our month-long coverage of the mental health maze that the criminal justice system was not designed to provide for the mentally ill. WAAY 31's Kat Reed joins us in studio with a new initiative officials hope will improve care for those inmates and save tax dollars. Kat.
Demetria, let's start by looking at the numbers. $48 a day of your tax money is spent for just 1 inmate at the Madison County Jail. Now, let's add mental illness to the equation. Studies show the average nonviolent mentally ill offender stays in jail 3 to 4 times longer than your average violent offender. It's a drain on resources. It's also a system in which inmates don't get the care they need.
Okay, love you.
We first met Jacqueline O'Neill in August. At the time, she was fighting for more resources at the Madison County Jail for her mentally ill son, a battle she says was going nowhere.
He hasn't been able to get any treatment aside from his medication.
Since then, O'Neill has been busy working with the North Alabama Mental Health Coalition and talking to state and local officials like Commissioner Bob Harrison. Her pleas no longer falling on deaf ears.
There are hundreds and literally thousands of little O'Neill boys like that in our community.
Harrison is spearheading a jail diversion initiative that would move mentally ill, nonviolent offenders out of jails and into treatment facilities. This week, the Madison County Commission will hear from Leon Evans, a mental health official from the San Antonio area who has implemented the diversion programs and seen success.
Our jail has 1,000 empty beds. The homeless count downtown San Antonio is down to 85%.
Evans says the program also saves money. Harrison believes those dollars saved will help pay for the new programs.
Not necessarily come up with new resources, but to transition the resources that we have to an effort that is more productive and more meaningful.
They're things O'Neill has been fighting for years. Now she's just happy leaders across the community are pulling up chairs at the table.
To see everyone interacting and trying to put their heads together and seeing what they can do, I mean, it really means a lot to me, my family, and everyone in the community.
One of the priorities in the Jail Diversion Initiative is opening up more beds for inpatient mental health treatment so these inmates have somewhere to go other than jail. And if you're interested in learning more, there will be a formal information session tomorrow at 10 a.m. at the Bob Harrison Wellness Center.